I'm excited to introduce Dr. Martin Bloomfield, who will be talking to us about the intercultural aspects in determining dyslexia. Dr. Martin Bloomfield is a highly experienced and recognized consultant, teacher trainer, lecturer, and speaker specializing in neurodiversity-related issues. He has worked with governments, delivered keynote presentations globally, and been at the forefront of special educational needs leadership for over 2 decades. Dr. Bloomfield's work has ranged from advising the UK government to leading international educational initiatives. He plays a key role in the development and passing of the Dyslexia Bill in the UK Parliament in 2022. He is a director of Beyond Inclusion, a charity trustee, and a member of International Forum of Special Education, also known as IASE. Today, Dr. Bloomfield will delve into how cultural differences influence the diagnosis and understanding of dyslexia, and explore the importance of intercultural perspectives in improving neurodiversity practices worldwide. Similar like before, there will be a question-answer session post his presentation. Let's give a warm welcome to Dr. Martin Bloomfield.
I just got to say, first of all, that introduction is hugely embarrassing after the phenomenal introduction we first had. Am I closer? I'm closer. Excellent. Excellent. And one slight errata, one slight correction to what you said. I did play a key role in the development of the Dyslexia Bill, but it didn't pass through the UK Parliament, because these things don't. And that's such a frustration. It got to the final stage of the UK Parliament, and there was a clash. There was only a very short time. And of course, politicians were behind it, but they weren't behind it enough, so they chose another one instead. It's very, very frustrating. Hi, anyway, my name's Martin. Pleased to meet you. Just a little bit about myself. I am a founding director of Beyond Inclusion. It's a holistic approach to inclusive education and business practices that we try to engender. It's not simply neurodiversity, it's ethics, it's safeguarding, it's complex needs. A trustee of the Accessible Learning Foundation. The Accessible Learning Foundation came from the failed bill that we tried to pass through Parliament. Essentially, there is a pipeline from school to prison. We know there's a pipeline from school to prison, so we're basically the plumbers. We're trying to stop the flow from school to prison. It's a very difficult task, but somebody's got to try it at least. Driver of the Dyslexia Compass. We'll come to this during the presentation. I'll explain what the Dyslexia Compass was, or is, during the presentation. It's one of my pets, it's one of my babies. Creator of the Dyslexia Map. I'm going to point out the Dyslexia Map during the presentation as well. It's a very amateurish thing, because I'm quite an amateurish person, ultimately. But I think it's quite nice, it's interesting, it's quite useful. A lecturer in intercultural ethics, an intercultural SEN. When I say SEN, S-E-N, it's a phrase we use in the United Kingdom, special educational needs. Sometimes you'll hear SEND, special educational needs and disabilities. I did very, very, very badly at school. I am very, very obviously dyslexic and dyspraxic, by the way. And you may notice with my energy levels, ADHD. And I'm founder of the Dyslexia Bites Project, and we'll have a look at the Dyslexia Bites Project as well. That's where I became really interested in intercultural issues. But first, on your tables, you have some post-it notes, some sticky notes. So you didn't realize you were going to have to work, did you? You had no idea you were going to have to work. So there are some sticky notes on your tables. What I'd like you to do is everybody just take 1 or 2 or 3 sticky notes, and on one sticky note, write one thing you associate with dyslexia. So it could be, I don't know, phonological processing deficit, or it could be superpower, or something. And then on another sticky note, write another thing you associate with dyslexia. And on another sticky note, write another thing you associate with dyslexia. Only about 3 will do, and I'll give you about 1 minute to do this. If you don't feel comfortable writing anything, you don't have to. It's not a test. Thank you. Everyone's thinking, actually, I know nothing about dyslexia. Okay. So this is more or less what we're going to do. And forgive me, I'm going to trip over this all the time, aren't I? This is what we're going to do. We're going to start by just asking a very, very simple question. And it's really, it's heartwarming, because actually what I talk about leads on directly from what you were talking about as well. And it deals with some similar issues. It goes in a slightly different direction, but deals with similar issues. I'm going to ask you possibly the simplest question, and if we could have the lights up, that would be great. Once or twice there'll be videos, and I'll ask to lower them, but generally speaking. So there's going to be a very simple question we're going to ask, and then look at some of the problems that arise from this. And then what we learn about this from dyslexia measurements, what we learn about the question from looking at dyslexia measurements, and what we learn about dyslexia measurements. This leads on to what I call the problem of inequality. There is a global problem of inequality where dyslexia is concerned. Really interesting, and you kind of find it out, you unearth it when you ask this simple question. Which then leads into something called cultural appropriation. Now, I don't know if you've ever heard the phrase cultural appropriation. Sometimes people use it to mean sort of white girls wearing dreadlocks or something. I mean, that's a rather trivial understanding of it. Cultural appropriation would be removing somebody's name and replacing it with a name from your own culture, something along those lines, or imposing your own cultural values onto somebody else's culture. This is a form of cultural appropriation, and it's a deep insult to the identity of the people that you're doing it to. There's a solution to cultural appropriation, but the problem with the solution to cultural appropriation is that itself it's problematic, and it brings about more iniquity and more inequality. So we'll have a look at that, and then finally we'll apply what we've learned from the previous stuff to create a better future based on looking at the iniquity of the solution. Essentially, I'm a hippie, and I want to try to create a better world. Which we can, and you are doing, by the way. You absolutely are doing. So let's just kick off. Here's a simple question that was asked in the first instance, so you all know the answer. Around the world, percentage-wise, how many people are dyslexic? Any guesses? So we heard in India 10 to 15%. So here are your options. I'll give you some options, okay? Option number 1. Is it fewer than 1% of the population are dyslexic? No. No, right, okay. Is it option 2? 5%, roughly 5%? No. No, okay. Option 3, 10%. Ooh, fewer no's, okay. Option 4, 15%? Yes. Ah, we get a few yeses here. Option 5, 20%. What about option 6? 33%. We've got a couple of yeses. Okay, so here's the thing. Regardless of what you said, you're correct. And this is one of the really knotty problems in dyslexia awareness. How many people are dyslexic? And one of the reasons I say this is this. One of the things I do is I look at different measurements of dyslexia around the world. This, again, is a very amateurishly made map, so forgive me. But in Nigeria here, you've got estimates, you've got official estimates, by the way, from anything from 20% to 33.33% of the population being dyslexic. That's huge. All the way down to Turkey, where they have 0.05% of the population as dyslexic, which is tiny. And somewhere in the middle, I mean, India has about 15%. The DAI claims about 15%, and other people in India claim about 15%. People on 15%, you're talking about India here, Australia, their upper value is 18% and their lower value is 8%. That kind of aggregates out as 15%. But it's a really interesting question, because why is it that so many people up here are measured as dyslexic? Actually, it's just guesswork, by the way. And so many people down here are measured as dyslexic, which is ignorance. Why is it? Well, one of the questions that you might want to ask is it about the language itself? Okay? And it seems like an obvious question to ask. Is it the orthography of the language? Okay? Most of you will know what orthography is. For those who don't, a very simple explanation. English has a very difficult orthography. If you see the letter G, you don't know how it's pronounced. It could be G, it could be J, it could be anything. It could be silent. Nat, for instance. So you don't know how the letter G is pronounced in English. But in Welsh, I lived in Wales for a while, if you see the letters LL, the phoneme LL, it's pronounced regardless of where it is. It's Llanfair Pilgrish, or Nadolig Llawen. Sounds horrible, sounds like an insult. It's actually Merry Christmas in Welsh. So it could be to do with the orthography. But what's really interesting is it doesn't look like it is. So let's just take 3 countries with basically similar orthographies. The UK, US, and Canada. And you'll notice that the estimates for how many dyslexics there are in these countries are actually quite different. There's quite big differences there. And then you take 3 countries with very different orthographies, Latvia, the USA, and the Netherlands, and you find that their estimates are about the same. So if we look at it in those terms, it's not obviously an orthographic issue. It's not obviously about orthography. So it might be something else. Might be something else. Well, let's have a look. I ran something, as I say, we're going to talk about this a little bit, called the Dyslexia Compass. And the Dyslexia Compass was a transnational project among speech and language therapists, teachers, dyslexia specialists around Europe to try to find out why there were such differences in the numbers. And these were some of the numbers we collated by interviewing loads of people, doing desk research and interviews. And these are the numbers we created. And you'll notice that even within Europe, it goes down from 4% here in Italy up to 25% in Iceland. And you'll see, basically, the blue is the lowest estimates, the purple are the upper estimates, and that's really interesting because very few countries have one number. Very few countries have one figure. And the green is kind of an average that I've given. And what we do often is we look at the green, we look at the average, and say, oh, well, there's about 8 to 10% of people with dyslexia around Europe. But actually, almost nobody has actually come out with the answer 8 to 10% or 10%. They're all sort of somewhere between 3% and 17%. Something like that, and the average is kind of 10%-ish, vaguely near. But that's a really bad way of doing statistics. You know, you can't say there's 10% of the population who's dyslexic in Latvia simply because some people think it's 4% and other people think it's 19%. It doesn't work like that. And if we do that, then what we're doing is we're risking having inappropriate provisions. Because if we don't know how many people are dyslexic, we don't know how to provide for it. And governments don't know how to provide for it. So giving simply some broad, general, vaguely in the middle figure doesn't always help. And by the way, when we look at these figures, let's take a look at the Netherlands here. Among the, I hate this kind of language, I don't know how to put it. Among the long-term generations in the Netherlands, so, you know, traditionally you might say the white indigenous Dutch, but really the long-term generations in the Netherlands, you tend to get figures of about 20%. Among the ethnic minorities, the figures are 5%. And that's why there's such a disparity. And so you've got this massive disparity between the migrant community and the long-term community. And there's an interesting reason for that, which we'll come to later. The EU, you've got the European Commission, and you've got the European Dyslexia Association, who give completely different figures, which is why you've got different figures here. And this we're going to come to later on as well. It's really important. So let's have a look at this. What I did is I aggregated the figures. Anything from like 8% to 9.5% to 10.8%. And you'll notice that if you look at it in terms of average figures, it looks like there is a relatively consistent number of dyslexic people around Europe. Whereas in reality, if we take the EU figures, the difference between simply the European Commission figures and the European Dyslexia Association figures, the difference between these two figures is more than the entire population of Poland. That's mind-blowing. The difference between the two official figures is more than the entire population of Poland. And so we have to be really careful when giving these aggregate figures. So we'll have a look. By the way, I love this. The D of dyslexia and the A of dyslexia, are they the same colour? Yes, no, yes, no. I mean, it depends how you look at it. They're the same colour, but they look very different depending on the background. And this is one of the things that I want to push forward here, that the background that we have actually has a massive effect on how we look for dyslexia. And it could be something to do with language, could be something to do with personal circumstances. When we look at personal and social circumstances, however, it's not obvious that we can make a particularly good deduction from that either. So I have something called the dyslexia map. I say it's a hobby. It's not a hobby, it's my way of procrastinating. So when I don't want to do any actual work, I go online and I build the dyslexia map. The dyslexia map is a Google map that I've created which tries to list as many dyslexia-focused organizations in the world as I can. I mean, talk about special interests. You know, this is something which is an obsession of mine. And what you'll notice is, let's just show you the basic map. This is a screenshot I took last night of the dyslexia map. And you can see that there are sort of gaps here in South America, and there are gaps in Africa. And what it does, it kind of shows you very broadly about how many organizations are focused on dyslexia in these areas, in these countries. And so, is there a national dyslexia organization in Libya or Algeria? No, there isn't. Are there any specific dyslexia-focused schools? I haven't found any yet. We can have a look a bit more specifically. So let's have a look at Africa. And you can see that there's a small cluster in Nigeria and a bigger cluster in South Africa. And it turns out that if we're looking in terms of, well, is there a cluster of dyslexia interest? Well, Nigeria, there's more of a cluster there, so maybe that explains the 20 to 33%. But then you look at other things. You look at India, and there are more in India, and yet they've got a lower figure of 10 to 15%. So again, it's not obvious. Then you look at somewhere else. You look at, for instance, Europe, where we've got such disparate views of how many people are dyslexic. And in Britain, our view is somewhere between 4% and 15%. 4%, by the way, is the figure given for people whose dyslexia is counted as a disability. 15% is probably up to 15%. And my dyslexia probably wouldn't classify me as having a disability, mainly because I've got so far, if that makes sense. So it's not considered a day-to-day hindrance. I mean, it is, but it wouldn't be legally considered one. So again, let's have a look at America. This is a really interesting one. America is round about 15%, but you've got all these associations over here, a few over here, and not that many in the middle. And so from this, you might want to say, well, okay, does this reflect in the figures? And it turns out that it doesn't. It turns out that it doesn't. So it's nothing to do with social attitudes towards dyslexia, or it might be a bit to do with social attitudes. So here, and you might think, well, is it about educational outcomes? So here in the South, in Missouri, Arkansas, Louisiana, Texas, you generally have lower educational outcomes, and they've got higher figures for dyslexia. 15% in Texas, 18% in Arkansas, 22% in Mississippi. And you think, well, okay, but they've also got quite high figures in New York, 12%, and California, 10%, where they've got better educational outcomes. And here in Utah and Nevada, where they've got lower educational outcomes, they've got lower percentages. So it doesn't look like it's that either. So maybe it's red state, blue state. Let's just throw this into the air. Let's have a look at red state, blue state in America, and no, it isn't. Ah, right. So we know it's none of these things, or at least it's got something to do with these things, but there's something else going on. In America, there's a really interesting fact about specific learning difficulties measurements and the figures for who has a specific learning difficulty. Let me show you this. This is fascinating. This is 4th grade reading outcomes in the United States. If you're white or Asian Pacific, you have a fairly good chance of being an advanced reader at 4th grade. Fairly good chance. White, 12%, Asian Pacific, 20%. That's fairly high. If you're Hispanic, Black, or First Nation, you're talking about 3 or 4% of being an advanced reader, which is a significant drop-off. Significant drop-off. Here, even being proficient, white, 33%, Asian Pacific Islander, 34%, and then you're down to 19, 15, 16%. Proficiency, if you're Black, Hispanic, or First Nation. If you go back to the back row, your chances of being below basic if you're white, that's if you're like in the bottom percentiles. Your chances of being below basic if you're white are 23%. If you're Asian Pacific Islander, 19%. But if you're Hispanic, Black, or First Nation, 45, 52, and 50%. So your chances of being a poor reader, depending on your ethnicity, are massively increased. And it's nothing to do with the ethnicity itself, it's to do with provision and all sorts of complicated socioeconomic educative factors. But once we look at that, you'll think, okay, so the Black Hispanic First Nation contingent of America have got lower reading outcomes, so are there going to be more dyslexia diagnosis for them? And it turns out, of course not. Of course not. So if you're Hispanic, Black or First Nation, and you're in the bottom percentiles of reading, you're going to be less than 50% likely to be given a dyslexia diagnostic assessment. If you're white, you're about 3/4% likely. So what you've got is you've got the ethnic minorities in America are far more likely to be below basic and far less likely to be given any kind of provision for it. And so this skews the figures massively. And then we can ask, well, okay, so if this is the case, if this skews the figures so much, is it the same elsewhere? We would normally assume, yes. We normally assume that in, let's say, Eurocentric societies, the figures are more or less the same. So let's have a look. First of all, I collected a few quotes. I've interviewed a load of people, and I've collected some quotes. Here, this is basically just some dyslexia and race education. I did what most black dyslexics do. I dealt with it and managed my challenges as best I could while suffering in silence. Here, a woman called Jeanette Morgan, I know her, I wouldn't say well, but I know her well enough. The majority of young black British people in the UK do not acquire a diagnosis until they are in university. And so you've got this anecdotal evidence. And by the way, is anyone here Muslim? Can I ask you, is anyone here Muslim? You don't have to answer, but if anybody is, it's really interesting because in Britain, there is a fear among working class Muslims about coming out as dyslexic. Not in different countries. So I've been to Qatar and I've been to Saudi and I've been to other Gulf nations. It doesn't translate there, but in Britain it does. And so there are actually structures set up. So there's both anecdotal and research evidence to show that a lot of British Muslims do not get themselves outed as dyslexic because they're frightened, because they think, oh, I can't read the Holy Quran. Or my parents are going to be ashamed of me. And so there is a lower, if you like, a lower percentage of Muslims in Britain with a dyslexia statement, if not diagnostic assessment. But it's actually far more complicated than that. This is where it gets a little complicated, so forgive me for showing some really boring sort of statistics at you, but this. Out of a total of 100 people, this was a really large survey done in the northeast of England, basically Newcastle, if you've ever heard of Newcastle, that kind of area. Out of a total of like 100% of a particular group, 25% of the kids were on free school meals. Now what that means in the British context is that they were poor. They didn't have much money and they needed free school meals. Of this same group, about 8% had some form of specific learning difference. And it kind of translates into what you'd expect. We then look at this. If you look at university entry in the UK, factored by free school meals, but factored by ethnicity, it turns out that for every 100, well, not for every 100, but out of a standard sample of 100, this was, by the way, a survey done with 5 million kids. This is a government survey, taken a long time with 5 million kids. 59% of black African kids on free school meals got to university. 59% of Bangladeshi kids on free school meals got to university. 32% of black Caribbean kids on free school meals got to university, but only 16% of white kids on free school meals got to university. And again, there are complex reasons, because historically when we got African Caribbean people coming to Britain, there was a lot of inequality and racism. Same with Bangladeshi and Indian people. When they came to Britain, there was a lot of racism. And so it was up to the governments of the 1970s and even the 1980s to provide help for them and sort of really focus on them. And this is why you'll get this kind of figure. You wouldn't do it with the white kids, because that would be almost obscene, you know, sort of we've got a load of mixed race, and then let's give the white kids some help. You know, that doesn't really feel right. But because of the racism and the structural inequalities, the ethnic minorities were given extra help, and you can kind of see that coming through here. Now, what this means is really interesting. What this means is that If you take the white British as a base marker of 1, then, if you like, there is an over and under representation of SEND statementing, special educational needs statementing, among these kids. So Pakistani origin kids are between 1.35 and 1.56 overrepresented with special educational needs statementing. Black Caribbean kids are similarly about 1.5 to 1.6 overrepresented. But here, Indian kids and Chinese kids are massively underrepresented in Britain with a SEND statement. And there are different reasons for the Chinese and the Indians to be like this, by the way, different socioeconomic, cultural reasons. And so, what we notice is that, let's take the Black Caribbean contingent here, that if you look at the kids on free school meals, then because you get more SEND statementing for, let's say, Black Caribbean kids, you get higher university entrance. And you get kind of lower SEND statementing for white kids, and you get lower university entrance. And so this factors into it. And by the way, in terms of who's on free school meals, proportionately, more Black, Asian, Afro-Caribbean kids are on free school meals than white kids. So what you have then is, in the American sort of continent, in America, it's fairly simple. You can almost draw this, you know, if you're non-white, you're disadvantaged in terms of whether you're likely to be given special educational needs statementing. But in the UK, it's more to do with wealth and class, and then all sorts of complex ethnic interplays. And this means that it's almost impossible to make that statement that it's to do with ethnicity. So we find that it's really difficult to make a statement to do with orthography. It's really difficult to make a statement to do with whether it's culturally bound. Very hard to make that kind of statement to do with ethnicity. So let's ask the obvious next question. I'm going to ask for an answer here. There are more male dyslexics than female dyslexics. There are more female dyslexics than male dyslexics. Or the numbers of male and female dyslexics are more or less equal. So who thinks A, there are more males than females? Okay, oh, it's almost like half here. Okay. Who thinks B, there are more females than males? 1 or 2? Who thinks C, the numbers of male and female are roughly the same? And again, it's really interesting. This is more male than female. This is roughly the same here. Fascinating. Fascinating. It drives me mad, actually. It drives me mad. If you go onto the Yale Centre of Dyslexia website and ask whether there are more male or female dyslexics, and in fact, other websites, there's a lot of them out there, actually, they'll say, in the past, we used to think that there were more male dyslexics than female dyslexics. But recent research, this is a phrase, by the way, I've learned it off by heart. Recent research has shown that there are actually the same number of male and female dyslexics. But the reasons that we think there are more males than females is that boys play up. Right, well, let me just show you the truth. There are more male dyslexics than female dyslexics. Here's why. A, playing up. If you're a black kid in America and you play up, you are going to be expelled. You're not going to get a dyslexia diagnosis. If you're a white kid in England and you're playing up, you'll be excluded from the class. I've spoken to teacher after teacher after teacher. I mean, there are some teachers here. How many teachers will think, this kid's playing up, whatever that means, I'll test them for dyslexia? It's not your first avenue of thought. Your first avenue of thought is get them out of the classroom, or they're a nuisance, or they're disruptive. So this playing up aspect is difficult to quantify. And then you've got questions of, well, how do you know that kids playing up in, let's say, Latvia, and kids playing up in America, it's the same with male and female. How do you know that male kids play up in Latvia in the same way that they play up in America? And is there the same number of kids? Because we saw that the numbers of dyslexia in Latvia and America are more or less the same. But is playing up the same? And is there this gender stereotype? Can you apply the gender stereotype across the globe? And it's very unlikely that you can do that. And so what I've done is I've collected some information. Here's more or less the research. The research that everybody says recent research has shown comes from Shaywitz, 1990. Sally Shaywitz. I'm not knocking her. She's a brilliant woman. Absolutely brilliant woman. Anybody who's in the world of dyslexia knows the name Professor Sally Shaywitz. It's just difficult to say. Professor Sally Shaywitz. Everybody knows the name. And she did a really important study in 1990 of 400 kids in an area of America. But since then, there have been so many studies that have come out that have said the opposite. Some of these studies use the same methodologies, some use different methodologies. And so what you've got is cross-methodological denial, or cross-methodological sort of, what's the word, sort of argumentation against Sally Shaywitz. So it doesn't look like it's totally anything to do with gender either. Because especially when you look at literacy outcomes in somewhere like India, then what you've got is male literacy outcomes 84.7%, female literacy outcomes 70.3%. This is 2025 figures, which shows that there's something more going on than simply male-female. There's something more complex. There's socio-economic and social factors at play in whether you're going to be statemented as dyslexic if you're male or female. And by the way, this average figure here, 77.7, you're probably aware this is the average figure for India, but each state has got very different figures. Generally, the south, you get higher literacy figures, so 96.2 in Kerala, all the way down to 66.4 in Andhra Pradesh. And so again, it's quite difficult to make these claims, because all around India, you've got different outcomes. And these different outcomes make it really difficult to make the claims. Could be something to do with this. This is a small-scale study, quite recently, 2019, in a private school, asking teachers, have you heard of dyslexia? 16 out of 20 said yes. Have you heard of dyslexia? In a private school, and 16 out of 20 said yes. That's not a high number. It's not a high number. And it might lead to this. School dropouts. So you've got quite low school dropouts and relatively even between boys and girls. And when you get to secondary school, school dropouts jump. And once school dropouts jump, then it becomes harder to test for dyslexia. Because a lot of dyslexia is spotted in the schools. And most dyslexia, unfortunately, is spotted around about secondary school time. A lot of it is missed before that. So, and it's, by the way, it's the same around the world. This isn't happening to go to India. India is as good as anywhere in the world. It's as good and as bad as anywhere in the world. I come from Britain. The figures are shocking in Britain. So let's look at other cases. I mean, Bulgaria, you've got an average of 50 to 60% illiteracy in Bulgaria. And among students, pre-16 students, 41% illiteracy in Bulgaria. Now, in Britain, they say that if you're illiterate, there's an 80% chance you're dyslexic. But I'd be very wary about applying that figure here, because that's not obviously true. Let's have a look at other countries. In Nigeria, illiteracy rates are falling, but they were 50% in 2012. They're probably about 33% now. I haven't looked. But this is more interesting. This is really fascinating, talking about whether teachers know. The question was, how many teachers had heard of dyslexia in Nigeria? Only 23% had heard. It's almost the opposite to India. So only 23% of teachers in Nigeria had even heard of dyslexia. And of those who had, only 10% said they'd taught dyslexic kids, which is quite a surprising, shocking figure. And then you think, well, they say they've got 33% of the population is dyslexic. That doesn't translate, because people haven't even heard of dyslexia. So where do these figures come from? Let's look at another country. We all think of Japan as really modern, and it is in so many ways, but teacher survey, what is dyslexia? 68% of Japanese teachers had not even heard the word dyslexia. 1% didn't respond, but of those who had heard the word, 31% who had heard the word, about half of them understood what it was. And so you've got about, what, 15% understand what dyslexia is in Japan. These are teachers. These are the people at the cutting edge. These are the people who are going to identify kids. And when we say, oh, boys play up, this shows clearly that if the teachers don't know what dyslexia is and a boy is playing up, the teachers are not going to go, oh, you're dyslexic. That's almost never going to happen. In the Gulf states, there was a survey done by UNESCO a few years ago, a good practice questionnaire of dyslexia in Arabic, and the majority of Gulf states didn't even bother to respond. I mean, okay, you look at places like Libya and Syria and Yemen, there'll be complex political and possibly even military reasons for that, but not for all of these states. So the majority didn't even respond. Which brings me to the fundamental question. Perhaps it's simply down to this question: what is dyslexia? Again, it's an easy question. We all know what dyslexia is, don't we? Put your hands up if you don't know what dyslexia is. Don't put your hands up, it's embarrassing. So let's just ask you a very simple question then. We all know very easy things. We all know what dyslexia is. It's very easy. We can just talk about it. Well, okay, I'm going to ask you a really simple question then. Okay, turn to the person next to you and answer this question. What sound does a dog make? In England, they go woof. What sound does a dog make? Turn to the person next to you and tell them what sound a dog makes. Now, from my extremely scientific research, I have discovered that in India, if you're in the northern Hindi areas, they're more likely to say bow wow or bo bo. And if you're southern, more likely vow vow, and I can't even pronounce the bottom one. Is that vaj vaj or something? What dog says that? Who's got what? Are you sure you're talking about dogs down here? That's not what dogs make. They go woof. Obviously they do. So even something we all know, even this knowledge we all share, we look at it differently. Here's a really simple way of demonstrating this. A really simple way. You've heard of the Rorschach test? Yeah? Right, we're going to do a little Rorschach test. Here we go. What do you see? Angels dancing. Beautiful. Anybody else? Butterflies, yeah? Birds? Lions. Yeah, lions. You do know that you're all looking at exactly the same thing, don't you? And you're all seeing something very different. So let's have a look at this next one. What about this? Oh, beautiful. Yeah, yeah, I like that. Oh, yeah, okay, yes, on the top, yeah. Does anyone see the spaces in between? It looks almost like an alien from Space Invaders or something. Next one. What do you see? What was that? Lions. Yeah. Oh, lions. Yeah, you see lions? Yeah. Next one. What do you see? Dancing. Ah, yes, dancing. Yeah. Yeah. Forgive me, this is how I dance. I don't know about anybody else. I personally see the markings on a death's head moth. But that's because I like horror movies and it looks like the Silence of the Lambs. So that's... What about this one? Yeah? Dragons? Dragonflies? Just a couple more. What about this? What's that? Charlie Chaplin, okay. That's brilliant. I'm going to explain something in a minute. Anybody else? What's that? Two men shouting, yeah? Spaceship? Yeah? See, this is one of the things. Our understandings of things are really culturally relative. I'm British. Do you know what I saw immediately when I looked at that? Winston Churchill. Yeah, you wouldn't have seen that. But to me, I go, oh, Winnie. I said, oh, God bless him. You know, I said, that's what I see when I see that. Other people wouldn't have noticed it. Two more. What about this? Circus. Spaceship. Rocket. Temple. A temple. Yeah, I see a temple. Yeah. Yeah, I've seen so many temples over the past few days that... A monster, the face of a monster, yeah? Dragon! Oh, I love the dragons. Okay, right, one final one. What do you see? Fire? Two women washing? Worshipping, two women worshipping. I've never had any women worshipping near me.
Buddha in the center.
Yeah, okay, something in the center. It's like a rocket, maybe, or something. Yeah, okay, yeah. This shows how culturally specific these things are. Does nobody else see this? Europe. Ah. Europeans are really likely to see that. Non-Europeans are less likely to see that. And this is a reason, because what we do is we see what we're looking out to see. How many people, okay, how many ginger cats have you seen this week? You have no idea, because you're not looking for them, because you don't know what it is you're looking for. But if I say, next week, look for some ginger cats, you'll all be able to count the ginger cats. It comes about in this. I'd just like you to watch this. It lasts about 2 minutes. Can we have the lights down very shortly for this 2-minute experiment? Many of you will have seen this, not all of you. Enjoy.
The monkey business illusion. Count how many times the players wearing white pass the ball. The correct answer is 16 passes. Did you spot the gorilla? For people who haven't seen or heard about a video like this before, about half missed the gorilla. If you knew about the gorilla, you probably saw it. But did you notice the curtain changing color or the player on the black team leaving the game? Let's rewind and watch it again. Here comes the gorilla, and there goes a player, and the curtain is changing from red to gold. When you're looking for a gorilla, you often miss other unexpected events. And that's the monkey business illusion.
Brilliant little illusion.
Learn more about this illusion and the original gorilla experiment at theinvisiblegorilla.com. Brilliant.
Great website, by the way. I've just noticed, I looked at myself and I'm sweating from the knees. Who sweats from the knees? What's wrong with me? What's wrong with me? I mean, it's warm here, but no one sweats from the knees. Okay, so what we find is, whatever you're looking for, you will miss the things you're not looking for. I guess at least a few people. Any hands? How many people missed the gorilla? Didn't see the gorilla? Wow! Yeah, about a third of you didn't see the gorilla. How many people did not see the curtains changing colour? The vast majority. How many people missed the person leaving the stage? Again, a similar number. I'll have a coffee. A similar number. But this is really important because it begs this fundamental question of what is it we're looking for when we look for dyslexia. And this is really interesting. I try to find out what dyslexia is. Okay? In Britain, we've had this thing called the Delphi definition of dyslexia. It came out in 2024, late 2024, and it's supposed to replace all the other definitions of dyslexia that we had. And it calls dyslexia a set of processing difficulties that affect the acquisition of reading and spelling. The most commonly observed cognitive impairment is a difficulty in phonological processing. Fair enough? Okay. Let's now have a look at the Maharashtra Dyslexia Association definition of dyslexia. A specific learning disorder. It is another way of seeing the world. Dyslexia occurs when the brain processes information differently, making it harder to translate language to thought, as in listening or reading, or thought to language, as in writing or speaking. Fair enough? Well, let's have a look at the IDA, India Dyslexia Association, Dyslexia Association of India. A neurological condition that is characterized by difficulties that mainly affect the ability of a child to read, write, and spell. Yeah? European Dyslexia Association, a disorder mainly characterized by severe difficulties in acquiring reading, spelling, and writing skills. International Dyslexia Association, a neurologically based condition that affects reading accuracy, reading fluency, and spelling, and unexpected difficulty in learning to read. You've all heard this. Finally, the Anthony Morris Foundation, specific learning disabilities, is about dyslexia, specific learning disability. And then under that, you've got all the other things that are unpacked. So when you look at specific learning disability, then it lists dyslexia, dyscalculia, and dyspraxia. So these are all the different definitions. Now, you're all nodding your heads, but they're all different. And depending on which one you accept, you're going to be looking for different things. And by the way, I'm going to show you this. I'm going to divide this into sort of sections soon. But let's have a look at what they really tell us about our views of dyslexia. Delphi. Difficulties, cognitive impairment, and difficulty. MDA. Got disorder, another way, and differently. DAI. Condition, difficulties. EDA, disorder, severe difficulties. IDA, condition, difficulties. AMF, disability. Now this matters. We'll come to why it matters very shortly, but this really matters. And by the way, in the Dyslexia Compass, this was carried out in 2022, I think. We found that most British diagnosticians took the British Dyslexia Association understanding, and non-British diagnosticians in Europe took the European dyslexia, the international dyslexia version of dyslexia. So they were taking different versions of the view of dyslexia. What we find is there are at least 28 definitions of dyslexia, and you can split them all into 4 categories. Now I call these categories origin, type, effect, and value. So origin, it'll be things like neurological, biological, congenital, genetic, constitutional. You'll see all these words in dyslexia definitions. Type, developmental, acquisitional, hereditary, innate. These are different. These are different. Hereditary and innate mean different things. Effect, you've got phonology, literacy, etc., and we'll come to this later. And then value, barrier, condition, disability, disorder, difficulty, difference, deficiencies, inefficiency, impediment, impairment. I hate it. It's so negative. There's only one here that isn't negative. Difference. It's kind of neutral. The only one that isn't negative. Now the reason this matters is this. Loads of people, I've chosen Pollock and Pitt because to me they're the standout ones. But over about a 15-year period, there was some research done on what the labeling of dyslexia does to people. And it turns out that there are more or less 4 labels. So this is 4 labels that researchers and teachers and parents might put on dyslexics. And they're the same labels that dyslexics might put on themselves. Okay, so what is dyslexia? And you can take a patient view. So patients, students, hemispherists, and campaigners. Patients take the view that it's somehow pathologized or medicalized. You know, I've got a condition, there's no cure for dyslexia. What are your symptoms? I got a diagnosis last week. This kind of medicalized language. Students take a deficit-based language. So things like slow reading speed, can't do this, writes things backwards, trouble with spelling, this kind of thing. So deficit-based language. Hemispherists look at the hemispheres of the brain and take essentially a differential view. It's about processing information. It's a neurological view. I process information differently from how you process information. And finally, campaigners take a social model. They say, well, dyslexia exists. What are we going to do about it? Now, depending on the label that you choose, depending on the language that you use, you have a measurable effect on the outcomes of kids in school. A measurable effect. Their educational outcomes, and therefore their economic and professional outcomes and their mental health outcomes depend on it. And we find that patients and students, that kind of language has a negative effect, whereas relatively hemispherists and campaigners have a positive effect. Now this matters because it's a simple thing, that the language we use has an effect on the kids we use it about. On your tables, you've written some things you associate with dyslexia. Okay? If you've written something really positive, stick it to that side of the table. If you've written something negative, stick it to that side of the table. Okay? So stick what you've written to one side or the other of the table. There is no middle ground here. I'm being cruel. Okay? So take what you've written. If it's positive, stick it that side of the table, that's starboard. And if it's negative, stick it to the port side of the table. Go, go, go. Let's take 1 minute, stick the things on the table. What do you notice? Is there more positive or more negative language? Generally speaking, it's more negative language. And you are the ones who genuinely care. This is the crazy thing. Don't feel bad about this. Everybody does this. Even I do it. We're the ones who care. And even we use this kind of language. Even the ones of us who really want to make that positive difference are still negatively impacting the kids we're working for. And it becomes even more important later on. But what I'm going to do is I'm going to show you very quickly. I'm going to show you the dyslexia compass. I can't believe I did this. This is really irritating. It's going to take a minute to... And there you go. I don't know why I did that. I just thought it would be fun, but now I realise it's stupid. So, right, the dyslexia compass took this idea and then it said, well, okay, different people look at dyslexia differently. We know this now. So we've got all these different views of dyslexia, these different national organisational definitions of dyslexia. So what is it that they're looking for? So what we did is we then interviewed, I don't know, a couple of hundred diagnosticians from around Europe. This is what we found, really interesting. First of all, we asked them what they thought was important in getting a dyslexia diagnostic assessment. Well, again, this is 3. Actually, half of them said gender isn't important, half of them said it is. So it came out as 3. A lot of people thought that ethnicity was important. Few thought that orthography, cost, or official, whether it's an official definition, are important. And I'll just mention what that means, by the way. I don't know whether the AMF definition of dyslexia will be taken as official in different parts of India, or even within this part of India. I don't know if there's an official... Does the Dyslexia Association of India, is their definition official? You know, it's difficult to understand what it means to have an official definition. Wealth didn't come out as highly, but social attitudes did. Social attitudes did. And then it turns out that we asked what they were looking for. This is really interesting. So, this was just from 6 different nations that we did this questionnaire. But all respondents said that they were looking for literacy deficits, slow writing, slow reading, poor spelling. All respondents said they were looking for phonological markers, processing, coding, encoding, blending, onset rhyme, etc., etc., etc. They all said they were looking for something like that. UK, Romania, Norway, and Croatia diagnosticians said they were looking at working memory. UK, Croatia, Spain were actually looking at context and history. UK, Romania, and Norway were looking at rapid automatized naming skills. UK, Croatia, Romania looking at visual perception. UK, Romania looking at non-verbal and verbal processing speed. UK and Spain were looking for a discrepancy model. UK, Romania were looking at motor skills. UK, Croatia were looking at math skills. UK, Spain looking at stress. UK looking at auditory. Romania looking at pronunciation. Spain looking at self-esteem and attention. So we'll notice that not only are they looking for something different, they're looking for different things, but they're looking at different things within that. Now, it's hardly surprising you're getting different numbers of how many people are dyslexic. Hardly surprising if one person's looking at the IDA definition, another person's looking at the EDA definition, and then within that they're looking at different things. Did a little word cloud because that'll be interesting, but it's ugly. So what I've done is I then basically ranked these in order of most people look for reading, spelling, and phonological processing. Then there's a second category where people are looking at writing, comprehension, working memory. Then the third category, some of them, so this is the most, slightly fewer, and not very many. Some are looking at family and background, which is really, really weird, because in Britain we think that's necessary. Some are looking at family and background. Some are looking at visual processing, and that's not words moving around on a page, by the way. That's letter string recognition, and do you get things right, left or right, that kind of thing. Then right at the bottom, very few of them, but still some were looking at motor skills, organizational skills, and math skills. So what we notice is if we wanted to give a definition of dyslexia based on what the diagnosticians are looking for, this would be it. This would be a definition of dyslexia based on what diagnosticians are looking for. But it's not the definition of dyslexia that their official dyslexia body gives. So they're not even looking for what their dyslexia body gives. They're not even looking for what the British Dyslexia Association says it is, or what the International Dyslexia Association says it is. They're looking at something different. And even within that, we can go more and more granular, okay? And I'm sorry for doing this, but this is really interesting. Even within that, we then asked, again, about 6 different diagnosticians from about 6 different nations. Okay, we've got these. When you look for these, which are the most important ones? And they disagreed. So, I mean, this is really interesting to me. Spain and the UK thought that phonology was really important. Phonological markers was really, really important. Letter recognition, you know, onset rhyme recognition, you know, rhyming, that kind of thing. But Norway and Romania, which actually came out as really similar results, but were completely separate and independent sort of questions. Norway and Romania put phonology as somewhere in the middle, so less important. And then look at working memory. So Croatia thinks that it's really, really important, but Spain doesn't really rank it that highly at all. And so when you're measuring for these things, not only are you measuring for different things, but the things that you're measuring for are given different ranks of importance. So if one person has got maybe poor working memory, but really good phonological processing skills, they'll be ranked as dyslexic in one country, but not in another country. And that really complicates things. They don't even use the same tests. This is just a selection of the tests that different diagnosticians were using. And by the way, here, Spain and Romania, Bender, the British don't use that anymore. I don't know if you've heard of it, but there's like advice, don't use this test anymore. It might blow up in your face or something. So we don't even use that test anymore. So most people, well, not most people, a few people use Wechsler, some people use Peabody, and then a couple of use Bender, that some people say you can't use that. So you've got all of these different factors playing into whether someone gets a diagnostic assessment. And then we looked at how many tests that people used. It turns out the UK diagnosticians listed 23 different tests. 23 different tests. Whereas in Norway, they got 1. And it's automated. Put it into a computer called Logos, which has its own issues and its own problems. Partially, and I'll show you in a second, partially because it's very difficult with an automated test to have confidence intervals. Now, British, UK diagnosticians, thank you, UK diagnosticians all insisted that confidence intervals are absolutely vital for a dyslexia assessment. But out of all the European nations we surveyed, it was only the British who even mentioned them. Many diagnosticians didn't even know what they were. I think this is huge. So do you use a discrepancy model? In the UK, we're told not to, but everybody does. Do you use confidence intervals? In the UK, we do, but nobody else does. Is it online or personal? In the UK, it still has to be face-to-face. Even over COVID, it had to be on a Zoom call. But it has to be face-to-face. But in some countries, it can be online. And in fact, there are many AI programs being developed. I know a number of people who are developing AI programs to try to do it. And then what kind of standard deviations do you use? So there was a study published by a woman called Feltin from Humboldt University in Berlin, saying that in certain parts of Germany they use one standard deviation, in other parts of Germany they use another standard deviation, and the differences between how many dyslexics they are come out as, in one part, 1.3% of the population, and in another part, 15.6%. The standard deviations are hugely important. And it's only by a couple of percentiles, only by a couple of percentiles. So we'll come back here, Remember this, and how even it all seems, round about 10%. Well, we'll look at this, and what we find is that the difference between the lowest and the highest is massive. Absolutely massive. And this isn't only the fact that it's a difference. What this means is that, well, first of all, Dr. Geeta said something to me last year, that actually we now have a cure for dyslexia. All you have to do is move house. You know, because if they measure your dyslexia in one way in one country and a different way in a different country, just move house, you won't be dyslexic anymore. Bingo, problem solved. There's that. There's also the fact that depending on where you are, I was going to say in the world, but in a country. So Germany has a state system where different Bundesländer, different states in Germany, have different provision based on the figures that they have, and the figures are different. India, similarly, it's a state system. America, similarly, it's a state system. So even within one country, if the figures are different, your likelihood of getting provision are different. So you can actually, and this is, you know, we say it as a joke, but it's true, we have evidence that people have moved house and lost their dyslexia. Official statement of dyslexia. Or some people have to move to get a statement of dyslexia so that they can get the help they need. And the only people who can do that, by the way, are the rich kids. The poor people can't do that. And so we've got uneven provision based on uneven figures, based on uneven understandings. One question we might want to ask then is, we look at these, it's like a heat map of how many people are dyslexic around Europe. Iceland, Norway, Spain, Romania, and I think that's Latvia, if I remember rightly. There's loads of dyslexics there, and then if you go to Denmark and Italy and Hungary, very few dyslexics in these places. And so this is where you'll find the differences of provision. You'll find the differences of provision here. And places, you know, the European Union, I mean, okay, Britain is still, in a way, a part of the European Union. Not really officially, but we still do many of the things that Europe does. The European Union wants to have a powerful Europe. It wants to have an economically stable Europe. It wants to have a socially stable Europe. But it can't. It can't have a socially or an economically stable Europe if some kids are getting the provisions they need and other kids are not getting the provisions they need. You can't have an economically and a socially stable India if some areas of India are getting the provisions they need and some areas of India are not getting the provisions they need. Because what you'll get at the very least is you'll get higher rates of graduation in some parts of India than in other parts of India. What you'll also get is you'll get higher rates of alcoholism. You'll get higher rates of homelessness, higher prison populations, higher recidivism once people have been to prisons. You get more mental health problems and fewer ways of dealing with that. It affects life literacy, by the way. It affects your life expectancy. So if you are dyslexic and you don't get the provision you need, you will have what they call lower health literacy. Health literacy is the ability to read, take in, understand health advice. But if you've got lower health literacy, you die earlier. There's actually a 76% chance that you'll die sooner if you have lower health literacy. Women with lower health literacy die about 21, 22 years earlier than women with high health literacy. Men with low health literacy die about 26 years earlier than men with high health literacy. So the death rate is affected. And if you've got an economic rate that's affected, then that'll affect what you can do about the people who are ill and dying. So there's a huge problem. Let's have a look at India. They tried to bring in, was it the Equality Bill in 2021? And it didn't work. They didn't manage to get it passed. Do you remember that? Some of you do. Some of you do. Yeah, but there aren't that many laws. We talked about the people with disabilities law. That's absolutely true. New Education Policy 2020. Rights of People with Disabilities Act 2016, the NT Act, the National Trust for the Welfare of Persons with Autism, Cerebral Palsy, Mental Retardation and Multiple Disabilities Act, can be interpreted to cover dyslexia, but often isn't, according to the research that I read. And then depending on where you are, there are different levels of provision at school. The brown areas, where I haven't said anything, I'm not saying that there are no provisions in these areas. But what I am saying is I looked and looked and looked and couldn't find them. Now, if I'm looking specifically for these and spending time looking for them and I can't find them, and you're a woman of the lower socioeconomic demographic trying to find what provision you can get for your kid, what chance does she have? And the provision is different, it's uneven. Maharashtra government provided concessions for children. Bangalore National Institute of Mental Health and Neurosciences has developed an index to assess children. Students in Andhra Pradesh are granted a scribe. There have been provisions granted in Tamil Nadu, and until recently, that's really interesting, until recently dyslexics in Kerala required a certificate with a learning difficulty assessment and an IQ test from a psychiatrist. So this IQ test comes back. And so we find that provision is uneven. And provision is uneven because people don't know, partially they don't know what they're looking at. To get past that, the British government ordered something called the Delphi Review of Dyslexia Provision, or Dyslexia. Now, the Delphi Review is a number of academics from different disciplines came together to try to find the perfect definition of dyslexia. Okay. It was specifically created, and you can read this in the British Dyslexia Association website. They were heavily involved in it. It was specifically created to establish areas of consensus to reduce confusion in how dyslexia should be defined. In other words, to create a universal definition for dyslexia. It sounds like a great idea because the problems that we've looked at show that there are different definitions of dyslexia, and that means people are doing different things and they're looking for different things. So clearly, if you have one definition of dyslexia, then it's going to make it better, yeah? Not necessarily. Because you'll actually come across really different problems. So have a look at this. Around the world, the British Dyslexia Association and the Delphi definition of dyslexia, these are the accepted norms in the United Kingdom. In America, there's a couple of organizations, the American Dyslexia Association, for instance, but they're a bit odd. So the International Dyslexia Association is the one that most people take. And AMF is affiliated to and accredited by the International Dyslexia Association. And in Europe, you've got the European Dyslexia Association, which is an umbrella organization. And basically, sort of, it doesn't call the shots, but it has a huge amount of influence, and whatever they say tends to go in a lot of Europe. So let's have a look at the heat map of this. Right. What you've seen is that the research and the definitions, so the research going into it, the definitions coming out of it, tend to be focused in these areas of the world, generally speaking. Okay? They tend to be focused in these areas of the world. What do I mean by that? Well, AMF, quite rightly, is very proud to be accredited by the IDA. But it's an American organization. It's what you would call a Eurocentric organization. So what you start to see is that perhaps these, if I may say so, white European parts of the world don't necessarily live in the same contexts as everybody in India or different parts of Africa. But if people in India and Africa are taking their lead from the American IDA or the British Delphi definition, then it might not always fit. You've got this area, and this area, massive populations of the world, with completely different cultures, completely different contexts, completely different aims and purposes. And I use this phrase, aims and purposes. Somebody, a friend of mine, Dr. Helen Ross, brilliant woman. If you ever look her up, Dr. Helen Ross, really good woman. She's written a book recently that she's going to publish, that she's published, but she'll have a launch party soon. And she's asking people, very quickly, what's your definition of dyslexia? And I said to her, well, I don't have one. Because if I'm talking to a 5-year-old who's just had a diagnosis of dyslexia, there's the word diagnosis. If I'm talking to a 5-year-old who's just had the diagnostic assessment of dyslexia, I'm going to tell her one thing. If I'm talking to a room like this, I'm going to say something else. If I'm talking to a teacher, I'm going to say something else. If I'm talking to a parent, I'm going to say something else. So my understanding, or my definition of dyslexia, is dependent upon my aims and purposes. And in different parts of the world, you have different aims and purposes. And if you're taking your understanding of dyslexia from a place with different aims and purposes, then you've obviously got a friction there. Here's why. Look at this. In America, you get this narrative these days. Dyslexia is my superpower. I mean, it's very positive. It's wonderful in a way. But it doesn't always work. In Britain, in Europe, it's called a deficit. Well, in certain parts of Africa, it's counted as a witchcraft curse. We're going to have a look at this in a second. Certain parts of Africa, it's counted as a curse through witchcraft. That's That's really harsh. In India, often, you don't talk about it too much. But in India, if you don't want to talk about it, if there's any kind of stigma or any kind of shame or any kind of misunderstanding, this idea of it being a superpower makes no sense whatsoever. But if you then say to kids that, oh, they're deficient, they've got a deficit, it kind of makes it worse. So if you're going to take these views of dyslexia and apply them willy-nilly all over the world, it's not always appropriate to do so. I'm going to illustrate what I mean. I'm just going to show you a couple of videos. Can we have the lights down, please? So this is from the Dyslexia Bites project. What I try to do is I try to interview people from around the world about how dyslexia is viewed in their context. Just three videos. They last about 4 minutes each on average, something like that. So I beg your patience with this. Also, they're from people from different parts of the world. So please try to adjust your ears, because different accents, different rhythms of speech as well will make it a little bit difficult to understand. I'll summarize at the end of each one. So here's the first one. This is from Korea.
But it is interesting that Korea always comes out really high in terms of results for schools, but it doesn't necessarily come out really high in terms of emotional, sort of the emotional evaluation, how happy and comfortable people feel.
Well, suicide is among the leading causes of death among Koreans aged 15 to 24, and also 10 to, like, there was like, I remember that one, like, where like a 10-year-old girl, like, I think she was 10 or was she 8, like she jumped, in any case she jumped to her death because she just couldn't handle or taking all the school lessons. You would just think at age 8 or 10 you should not commit suicide. It's like,
yeah,
they're really good when it comes to learning, but I think there's something missing, like the human element in a way.
Yeah,
I mean, it's missing out.
That whole thing about child suicide is horrifying, isn't it? Absolutely horrifying.
It is.
Yeah.
It is, like, I know in Korea it's extremely high. There's also like this bridge spanning the Han River, and it's infamous for people committing suicide. Now they have like put like pictures in place, like, or like baby pictures, dog puppy pictures, or like even nice text, just to make people like, maybe people want to change their minds. But I'm always thinking, but maybe it would be more, instead of putting up pictures, I mean, it's one thing, but something else would be maybe more helpful.
Yeah, changing the structures of the education system that drive people to suicide, for instance.
Yeah, or being able to openly say that you're going to see a psychologist.
Yeah. Openly having the ability to openly have a conversation about learning differences, that sort of thing.
Yes.
Yeah.
The most prevalent cause of death among 15 to 20-year-olds is suicide in Korea, and even among 10-year-olds. And they have a bridge where they put pictures of puppies to stop children throwing themselves off the bridge. And I'm sorry, every time I talk about this, it makes me well up a little bit, because I see it over and over again, and this is what not understanding does. And this is what taking an inappropriate understanding will do. Let's have a look at another one. This is Nigeria. There's a woman in Nigeria who runs an organization called Haven Homes Foundation. And it deals with a number of issues: mental health issues, learning disabilities, learning difficulties, all sorts of things.
This gap might contribute to something talked about slightly earlier, which is the mental health issues of special needs kids. Could you talk about that a little bit? I mean, perhaps with dyslexia in mind, but also general.
Yeah, so basically with dyslexia, there was a research that was done by one of the newspapers here in Nigeria, The Guardian, and what they were saying was when they went to a prison, they had a prison visit here in Nigeria, and there were a lot of people in the prison, and these prisoners most of them happened to be dyslexic. Most of them are school dropouts. They had to leave school because they were not able to fit, because that's the word to use. They didn't fit in the society, they didn't fit in the educational system. Because of this gap in the educational system, the teachers were not able to pick out the signs that these people or this class of children have an issue called dyslexia that probably with assessment and intervention, they could have done better, because like we all know, dyslexia does not affect the intelligence of a human being. It's only a language issue. It's a reading problem. But because we do not have people that are skilled enough to understand and help these children, you find a lot of children that are dropouts, a lot of children that go into drugs, and drugs comes with mental health challenges. You have a lot of children that actually become thugs. They maim people on the street, and then they end up in the prison. And then when you go to the prisons don't look good. Definitely they go through a lot of mental health issues. Some of them commit suicide because there's no acceptance in the society. So it's really a huge problem here. It's a huge problem.
And you say that you don't come from Abuja, you come from somewhere else. So does this mean that in different parts of Nigeria, there are different attitudes to special educational needs and mental health problems? And that if you have, for instance, autism or dyslexia or some other need, and you have accompanying mental health problems, you're more likely to get help in some parts of Nigeria because you're more likely to talk about it.
I think it has to do with enlightenment. You know, where I come from, like I keep saying, the northern part of Nigeria, we have a lot of work to do because there's lack of awareness, there's no enlightenment, and the level of literacy is very low, especially in Kano. We have a lot of people that are not really educated. And so when you're not educated, you don't even know anything about mental health challenge. So it's something that needs to go through the grassroots. And then we have culture. And when you're talking about culture, culture plays a vital role in our lives. And so culturally, you're not supposed to talk about, because even if you're talking about mental health issues, we have, like for me, I go through a lot of challenges because I have special needs children. And where I come from, these children are termed as evil or being possessed by some kind of spirit. So they don't really have the knowledge about this thing could be medical, and then with medical help, your child could get better. And so in a lot of villages, you find these children being killed because someone somewhere told the parents that, no, this child is evil. You have to get rid of the child because this child will actually make you lose everything in your life. So there's a big gap when it comes to the educated and the uneducated. There's a huge gap. But we're trying to fill that gap up. We're trying to spread the enlightenment, the awareness, so people will get to know what these things are. Yeah.
And these children, you say, they might get killed.
Yeah, a lot of them have been killed. Yeah. Because there's no awareness. The parents don't know better, and there's nobody to tell them that these things are related to a medical condition, that with medical help, it could get better. But because they don't have the education, they don't have the knowledge, they resort to the easier way for them. The easiest way is to kill the children so they can have a fulfilled life. Yeah.
The easiest way is to kill your children so you can have a fulfilled life. If I wasn't being recorded, I'd be swearing right now. It's absolutely horrific. Now, when I say these things, I don't want to say that they're culturally specific to deepest, darkest Africa in this racist, stereotypical way. This carries on even into Britain, into the United Kingdom. So I talked to a woman called Deborah from an organization called Afruka, which is about childhood safeguarding among African origin families in the United Kingdom. This is what she had to say.
Yeah. And actually, this is how I first came across you. You produced a fascinating and very powerful booklet called What is Witchcraft Abuse? Could you talk about that? So you describe witchcraft as the invocation of alleged supernatural powers to control people or events using sorcery or magic. So I suppose one of the questions is, does this relate to specific local beliefs of certain sort of backgrounds, or could it also relate to, for instance, more familiar religions such as Christianity?
I think witchcraft, it cuts across different cultures and religions. So witchcraft is known by various names across different cultures. So, for example, in the Congo, it's known as Kindoki. It's known as a gene in Tanzania and parts of North Africa. It's known as Aje in Nigeria among the Yorubas, Obie in the West Indies. Also, many Christians believe in spirit possession, but they often make a distinction between possession by the Holy Spirit and possession by evil spirits, because witchcraft is considered to be, evil or the work of the devil.
Yeah.
Islam as well also recognizes the existence of evil spirits, which is called jinn, that can take control of human beings. Islam, however, explicitly forbids the practice of witchcraft.
Right, yeah. Whereas, for instance, Christianity doesn't forbid the practice of witchcraft.
So you could be a Christian and still believe in certain, things, yeah.
Yeah. And in one section of the booklet, you list a number of categories of children at risk of witchcraft abuse. So being abused because of perceived witchcraft. And of these categories, you include children with dyslexia, autism, epilepsy, Down syndrome, and behavioral challenges, as well as being left-handed, and children whose parents were seen as, let's say, whose parents are seen as affected by witchcraft. I mean, what's going on there? What kind of psychological or physical effects might a branding of witchcraft have on, let's say, dyslexic or autistic children?
Yeah. You find that the list, in terms of children who are at risk of witchcraft abuse is quite extensive. So even children that, maybe might have nightmares, that sleepwalk or bedwet, children living with albinism, or who identify as LGBTQI, or children living in families affiliated with faith groups that strongly believe in witchcraft and in forceful forms of deliverance or exorcism rites. They may also be at risk of witchcraft abuse. In terms of, the effect that this can have on children, when we talk about emotional abuse, for example, I think the labeling of the child as a witch is in itself, it can cause long-term damage, and affect the child's overall well-being. When you talk about the verbal abuse, the threats, the curses, and even the knowledge by the child that he or she is hated by everyone because they are a witch, then there's a self-torture because this child thinks that they are a witch and they are responsible for wicked or evil acts on people. Psychologically, you can talk about the stigma, the dehumanization that child suffers, the psychological control that comes with that, leading to things like, low self-esteem, post-traumatic stress disorder, and even mental health problems, not only in childhood, but even into adulthood. Other effects, again, can include, the child being isolated or ostracized from other members of the family or the community. They're not cared for, they're denied, any form of attention because, of course, this child is seen as evil. So they're missing out on a lot of things, even including education.
And is there a way of, I don't mean is there a way up, but is there a perceived way of sort of curing a child of being possessed? Or is this, is it a lifelong condition, or what would happen there?
So sometimes you might find that there's this, in a bid to rid the child of this evil spirit, a deliverance or exorcism would be carried out on the child, as a way of ridding the child of this evil spirit. And that can take many forms,
Yeah, and of course an exorcism might itself be quite a traumatic thing for a child.
Absolutely. You can talk. We've talked about some of the emotional and psychological effects of witchcraft branding and the exorcism rites, but you can also look at the physical side of that in terms of the physical abuse that the child might suffer. Where the child is beaten, is starved, as a way of trying to rid the evil spirit from the child. And you find that sometimes sexual abuse does happen in such cases because the child might fall into the hands of opportunists. Because in some cases, no one really cares about what happens to the child, or maybe the child has been banished from the family community. So yeah, it can take many forms, and sometimes it does lead to that in some cases.
This is the United Kingdom, where we claim to be a modern Western democracy. And you got children banished from the family, ending up in sexual abuse, beatings, stabbings, exorcisms, leads to death. And of course, if you're going to accuse a child of witchcraft because that child is bedwetting, well, where does the bedwetting come from? It comes from many causes, including traumatic schooling. And so you're dyslexic, you wet the bed. You're accused of witchcraft, you get beaten, you wet the bed. You get an exorcism, you get banished from society, you get sexually abused. It can lead to death. This is a cycle. It's a cycle, and it's intercultural. And so we have this issue that it becomes really difficult to necessarily say in all communities that, oh, dyslexia is this, because different communities look at it differently. They understand it differently, they stigmatize it differently. But there's other things as well. So we talked, Deborah talked about Nigeria and Aruba. English is a morphemic language. Many Indian languages are very morphemic in nature, morphological in nature. So, you get product, induct, reduction, tear duct, air duct. These morphemes, if you like. And what the research says is that you can help teach dyslexics how to spell and how to read more fluently and more comprehensively by teaching them morphemes. But not every language has morphemes. So Mandarin Chinese isn't morphemic at all. Vietnamese isn't morphemic. Yoruba in Nigeria isn't morphemic. So when people talk about dyslexia as being morphemic in nature, then you have to be linguistically literate at the same time. Here's another thing you have to be literate about. Here's 3 circles. Here's 3 circles. One of them represents the past, one of them represents the present, one represents the future. Which is which? Any idea? The past is left, present is, future is, why? Because we write from left to right. Actually, it's kind of true, but not all cultures do that. So in Peru, there's the Aymara culture. Really interesting. The Aymara culture in Peru, they write from left to right as well. But they think that the past is something you can see. So it's out ahead of you. So the past will be on the right. And the future you can't see, so it will be on the left. So even languages that write like that will have a different view. Now, time is really, really ingrained in everybody's understanding of the world. It's one of these, we call it a norm, an unspoken norm, our perception of time. I'm just going to do this. Okay, these are 3 circles that represent time, past, present, and future. We happen to see them as past, present, and future because we write in a specific way. What about this? This is how I see it. This is how I see time. Which one's past, which one's present, and which one's future? The small is past? Bigger one is present? The other one is future. Does everybody agree with that? Does anyone disagree with that? I see someone shaking her head. Does anyone, or were you just going, oh, this is terrible? Will really stop? Yeah.
So the bigger circle is past, the smaller is the present, and the middle one is future.
Right, okay, so we've got 2 distinct views. What I drew, this tiny one, is the present. Because for me, it's over like that. The present is really, really fast. I live in the past because I'm a boring old man. But what I mean is, I live in the past. Whatever I say is based on what I've just heard. It's based on my experience. I judge you because of the things you have done. So in many ways, I live in the past. The present's really quick, and the future's quite far away and bigger than the present, but not that much bigger because I'm getting older. Other people see it differently. Now, this is a really basic concept, time. And what you'll notice is you can do this with your if your teachers do it with your class, whatever. Draw time geometrically, see what you get. And you'll notice that on such a basic concept as time, everyone draws it differently. And yet, the British Dyslexia Association says that dyslexia can affect memory, organisation, and timekeeping. But timekeeping is a culturally relative concept. It's a very culturally relative concept. Chronos and kairos, if you know what that is. Chronos is the Greek concept of time, ticking by, 1, 2, 3, 4, 5 seconds. Kairos is this deep experience of that moment in time. And so some people really, they're sort of kairos people, and some people are chronos people. Some cultures are kairos cultures, some people are chronos cultures. And again, you look at the map of the world, some cultures are very time governed. I've lived in Germany and I've lived in Switzerland. If you are late for an appointment, they actually arrest your parents. No, they don't, but you know, they might as well. They might as well. Nobody is ever late for an appointment. In Britain, if you are on time for a party, it's considered rude. Yeah, if I have a party and say it starts at 8 and someone turns up at 8, I think, what are you doing? I haven't even showered yet. You know, this is the way it works. In different parts of the world, in different parts of India, people have got a very different view of time. But in different parts of India, I have read, and you can correct me on this, time is governed by people. Whereas in Switzerland, people are governed by time. There's different attitude to how we relate to time. And so if we think of dyslexia can affect our timekeeping, again, this description of dyslexia from the British Dyslexia Association is a cultural description. Very cultural. So if we're going to try to avoid one description of dyslexia, so if the problem is, on the one hand, you've got all these different descriptions, all these different definitions, and you get a mess, you get no consistent provision. On the other hand, you get, let's say, one definition, but it's not culturally appropriate, there's an obvious solution. This is what everybody says. This is the solution everyone says. We've got technology. And with technology, we can communicate around the world. That's how we do it, yeah? We use technology to communicate. We have a democratized, universalized conversation to find out what we, as a democratic, universal, global village of people, understand by dyslexia. But the problem with this, sorry, I'm getting a bit philosophical, but the problem with this is that as soon as you do that, then you've got to ask, which parts of the world is the research being carried out in? Which parts of the world is the money in? Which parts of the world is there more access to technology and less access to technology? Because once you ask those questions, and what parts of the world do people listen deferentially? And what part of the world do people tell you things? Because when you ask these questions, you'll realize that as soon as you globalize the conversation, as soon as you make the definition a universalized democratic definition, then you've got inequality under cover of equality. So people say, oh, we asked everybody and now we all agree on this. So this is the universal description. But actually, it's an unequal description. Because people aren't playing fair. It's not an even playing field. I'm going to stop in a minute, but this is a really interesting thing. Technology as well has one more effect. One more effect, and it comes back to where we started from, by the way. Technology has one more effect. It's a really important effect. We all use AI, yeah? Everybody uses AI. Everybody. You've got a mobile phone. You use AI. Everybody does. There was a study done a couple of years ago about AI and bias. Really powerful study. Look it up. Nicoletti and Bass. Really, really important study. What it found is if you type into AI, image generating AI, criminal, it'll come out with a black person. If you type into AI, terrorist, it'll come out with a Muslim. If you type into AI, low-paid worker, it'll come out with an Indian woman. If you type into AI lawyer, it'll be a white man. Deeply, deeply biased. AI is deeply, deeply biased. And what happens, therefore, is as soon as we put AI into, for instance, recruitment or HR or loan allocation, or educative practices, or medical policy. As soon as you put AI into this, you're already factoring bias into it. So, some colleagues of mine at a German university and I decided that we would do the same for dyslexia. And by the way, when we said what you do is you analyze the emotions on the images that are generated. So, for instance, here, it might not look like it, but this is what the programs show you. You got anger and surprise, like that. Anger there and surprise. And that's what these things look like. So what we did is we decided it would be really fun and very enlightening to put into AI, image generating AI, things like manager and then dyslexic manager. See what happened. Now, I'm not going to bore you with this, but essentially what this tells you is that taking these, here we go, taking these jobs, high stake, high money, and taking these jobs, it turns out that dyslexics are perceived as happier in low-paid jobs than in high-paid jobs. Yeah. And it turns out that in every job, non-dyslexics are happier than dyslexics. But the gap between dyslexics and non-dyslexics in the low-paid job is smaller than the high-paid job. So essentially, if you're going to recruit someone and you do it through AI, you're not going to recruit the dyslexics. And if you do, you're going to push them into the janitorial jobs, the janitor's jobs. And so what we have is this is beautiful. We just put into this thing, this is the first iteration. It wasn't one that we used for the final study. This is the first iteration. We just typed in manager. And what you get is a handsome-looking white man. Yeah? How many people in this room look like that? It's not even me, I'm not even handsome-looking. You know, it's like, what you get is you just get this beautiful-looking white man. That's the manager. Then we typed in dyslexic manager and got this. Now, if it wasn't so terrifying, it would be hilarious. If it wasn't so terrifying, it would be hilarious. What you've got is you've got somebody who is clearly surprised. That expression, surprised, which shows lack of competence, lack of ability to cope, lack of ability to predict, lack of understanding. And here we have, I'll show you these same pictures. These actually came from the study. You've got a dyslexic male lawyer looking angry, dyslexic male judge looking surprised, dyslexic female judge looking angry, dyslexic female teacher looking surprised. You've got these, as it were, these social status jobs. The dyslexics are not happy in these social status jobs. So we know that as soon as we start communicating, as soon as we start using digital technologies to communicate, there's already bias in that. So this is where we actually come to a solution. This is fascinating. So here we started with this. And I said at the end, we're going to try to apply what we've learned to create a better future. This is my hippie bit, right? This is my hippie bit. It turns out that what we need to do is, first of all, we need to recognize the issue, the vulnerable people it affects. We know how to do that. We've seen it. Then what we do is we try to understand that this is because of the lack of consistency in measurements. Then we try to tackle the inequalities that come from this while being alive to the problems of universalization and inequality. Then we have to accept agency in this. This is what's really interesting. It means we return to the beginning. It is absolutely possible to change the algorithms that AI operates upon. Absolutely possible, and really, really easy. All we have to do is take these pieces of sticky notes that we did earlier on, and every time we wrote something negative, rephrase it. Write something positive, or at the very worst, neutral. And every time you write about dyslexia, on the internet, or on any digital platform, use that positive language. Because as soon as you use that positive language, then you're twisting the algorithms so that the dyslexics themselves are not disadvantaged. And when you have that universalized conversation, then you're reducing the inequalities of the universalized conversation. And so what we find is we have agency. We can actually do something. We can make the change. And I know we had this conversation about making change. Whatever you mean by that, we can actually make a difference. We can make a difference just by reflecting upon our language and changing our language. And I like to think that what's really interesting about this is that it simply came from the very first question. How many dyslexics are there in the world? If you want to get in touch with me, you can scan these QR codes and I will be online on LinkedIn and in my company. Thank you very much for listening. I hope it hasn't been too boring. I went over by 5 minutes. I apologise. Thank you. Well, I'd like to ask,
And with all the research that you've looked at, what about the research in Arabic languages? Is there anything out there that sort of...
There's less of it. So I've looked at some research from Arabic papers, but I can't read Arabic, so I've just had to look at the English language research in the Arabic papers. What you notice is that the Arabic states are on a trajectory similar to India, but actually really quick. So the Arabic states began with an absolute lack of understanding, and then it became a really negative understanding, and now they're sweeping upwards towards a positive understanding of dyslexia. It's really interesting. The Arabic states is like a brotherhood or a sisterhood. So they're all very closely knit, and yet there's different levels of provision. So in Oman, there's almost no provision at all, whereas in Qatar there's a lot of work being done, and Saudi again quite a lot of work being done, and the one with the Burj Khalifa, where was that? Sorry, Dubai. Yeah, there's a lot of work being done there, but a lot of this work is being driven by international schools, and that's something. And what will happen is that the governments there and the organisations there will take over from the international schools, but the international schools are driving the change. And you might find that something similar happens in India. I don't know.
But is the change only in English language, or is it also applicable in the local language?
Right, okay, so first of all, the changes in the English language, and second, the changes in the rich parts. So it's a problem that I've got, and I really do struggle with this. I go to various Arab states from time to time, and I work on inclusive programs, and the inclusive programs are all in the private schools, all of them. Now, on the one hand, this is good, because there's at least some inclusivity going on, at least there's some inclusive programs. But on the other hand, you can understand the social issues that this brings about, and the extra levels of inequality that creates. So yeah, the work is done in the private schools, and the private schools are English language based. So yeah, it's still a long way to go. Still a long way to go. Anybody else? Oh yes.
I can add to this. Since I was in Muscat for a few years, same thing is happening in the Indian schools in Muscat. So we have this inclusion setup, a body, and we are doing, they were doing at that time, this inclusion work just started in the 19 Indian schools a few years ago. And as you rightly said, in the Arabic language there is nothing, but the government of Oman is very keen on learning about this. So I hope something happens in the next few years.
Yeah, hopefully, yes. Yeah. If I can make a plea, by the way, and Kabir's going to hate me for saying this, because he knows what I'm going to say. You've seen, I've played you a couple of clips from the Dyslexia Bites channel, which is aimed at raising awareness and spreading a more intercultural perspective about dyslexia. If anybody would like to talk to me on camera, to go onto that channel about your experiences of dyslexia in India, I will be more than happy. So just find me and grab me, and I'll get out my mobile phone and go, talk, damn it, talk. So that'd be really nice. Thank you very much. Thank you, I really appreciate it.
Thank you, Dr. Martin, for sharing your insightful perspective with us today. In our little chat earlier, you had mentioned feeling a little nervous, but I must say you did a fantastic job. And I think all of us agree to that, right? Yes. Your passion truly shines through in the way you've mapped locations in your spare time and gathered codes, statistics, and global data to enrich your insights as well as ours. Your explanation of how labeling can seriously affect the perception of dyslexia was especially thought-provoking. The videos you shared were deeply moving, highlighting the heartbreaking reality in some places where children even lose their lives because of the stigma. This is a crucial issue that needs attention, and we truly appreciate your dedication in bringing it to light. Thank you very much. As the speakers advocate about various routes for holistic teaching, we are venturing holistic nourishment. Please join us for lunch. And post-lunch session will start at sharp 2:15 p.m. Thank you.
Lunch is at the ground.